A huge thank you for everybody that came out this morning. We are very excited about this conference. This is actually the first time that we've had a patient and caregiver conference since before the pandemic. And so having the ability to all sit together, discuss, handshake, hug, break bread, this is how we build community. And I love having this in person as compared to Zoom. Zoom did wonderful things for us during the pandemic, but it's certainly not as personal as seeing people face to face. So again, so thankful that everybody came out. Would like to extend a huge thank you to the Kidney Cancer Association. I'm going to be passing the baton over in several minutes to them to introduce themselves, but they have played a huge role in patient caregiver education, for patient advocacy for patients with kidney cancer. MD Anderson, I would like to extend a huge thank you to our administrative team, particular Ginger Arujo and Tati Robles, who helped put this together. On the KCA side, Amy Marba did a tremendous job connecting us. We have had Sarah, Radha, we've had so many people spend a lot of time and effort on this to make this a reality. So when I think about kind of the pyramid of what we're doing, patients are always at the very top and give us inspiration to continue to work and find better ways. Patients end up going through a lot of physical, emotional, and spiritual challenges during their entire course with kidney cancer. Right next to our patients and right on the pyramid are our caregivers. And so a huge shout out to all of our caregivers, because our caregivers are the ones helping patients come to appointments, helping share good news and bad news, celebrate and cry. They're instrumental in how patients do. And so whether that's a spouse, a parent, a child, a sibling, a friend, caregivers are a huge part of this journey. So thank you for coming. This is a huge community, and our entire purpose of today was to showcase how big of a community this is. We have providers from lots of different disciplines that are going to come and share their expertise. And I'm very excited to share this kind of breadth of knowledge with you today. Just as important, we have 3 patients that are going to speak today about their journey, because this is really important that we connect. As we bond together, patients, caregivers, providers, people of interest in kidney cancer, this is when we make major difference and major change. So thank you all for taking time out of your busy schedules to join us today. And I'm going to pass the baton to our esteemed panel up here. A huge thank you to Joel Stern for helping sponsor today's conference. And Dr. Brad Leibovich, thank you so much for coming down here today. And Gretchen Vaughn, who's the head of the KCA, thank you all for your time and helping us put on this great conference today.
Thank you so much, Matt. I think most of us up here are just here to thank each other, because we are so excited being the first in-person meeting for all of us, MD Anderson as well as KCA after COVID. I think the main word that you said that really resonates with me is connectedness, because I think we learned nothing more than how important that was after a period of time like COVID shared with us. So one, I'm Gretchen Vaughn. For those of you I've not had the privilege of knowing yet, I am the CEO of the Kidney Cancer Association, but I am filled with emotion today because MD Anderson is really a home to me. I was here working at MD Anderson for 14 years before I moved to the KCA, and with Dr. Christopher Wood, who at the time was the chair, and now his esteemed and one of his best friends, Brad Leibovich, is now our chair, and that's why he is definitely, we've asked him to come today to meet each of you. So please do take the time to speak with us, introduce yourself to us, as well as to our sponsors in the back as well, because we're all here together in one unified voice to do everything we can to make things better for you. I not only worked here, I was a chaplain here. I feel like I lived here. But at the same time, I've had many, many family members and friends that I have been the caregiver for and have spent enormous amount of times on that side of this coin as well. So I'm very familiar with what you're going through. I'm very empathetic for that. So much of that learned knowledge, both personally and professionally, I've taken with me to the KCA. And that's how we have come up with the services and the programs that we have created so far. But if there's more ways that we can support you, support your caregivers, support the medical team, that is, we're all a team in this, basically. And we want to learn from each other. We want to help each other, and it's going to take all of us to put this one in the history books. So again, thank you so much. If you are not familiar with us and our services, we try to be an extension of your care team, both with um, uh, support groups online. We have mentorships where we connect you with another patient that's already been through maybe the next phases of your journey that could help you. We have a human being who is a patient navigator. She's actually here today. Her name is Rosemary. So if you have not met her, please do, because she is available via a 800 number that can walk you through any questions or concerns, connect you with additional resources outside of google.com, which we already know is a little flawed. So in any event, I will hand it over to my boss and one of my dearest friends, Bradley.
Hi. Uh, First of all, thank you so much for being here today. As Gretchen said, I have for the past approximately 4 years had the honor of serving as the chair of the board of directors for the Kidney Cancer Association. So in that capacity, first, I will say a big thank you to our sponsors for this meeting, Pfizer, BMS, Merck, Aveo, Asai, Elixis, and Telix. Thank you for your support of this patient symposium. And I'll introduce and thank the man sitting to my left, your right, shortly. So just briefly, I'm a practicing urologic oncologist. I do consider MD Anderson to be my second medical home. I've never actually worked here, but as Gretchen said, Chris Wood and now many on the faculty here are great friends of mine, and I have adopted them as my second medical home. I practice at Mayo Clinic up in Rochester, Minnesota, where it is much more cool. I learned that you don't walk any place in Houston this morning. It seemed like a short walk. I actually started my urology training in 1995. In 1995, we had one FDA-approved drug for kidney cancer, and we basically did one operation. So virtually everybody, no matter what stage of disease they had a radical nephrectomy, and we had one systemic therapy that did not work very well. In 2024, we have over 20 different approved therapies for kidney cancer on the medical side. We have surgeries that spare kidneys and target metastatic disease that are minimally invasive, completely non-invasive. And when we're forced to do open surgery, patients get out of the hospital with much less morbidity and much faster, and return to their lives much faster. So why am I with the KCA? Well, that's good, but it's not good enough. So the KCA exists, as Gretchen said, to fund research. So we fund cutting edge research to improve outcomes for everybody with kidney cancer across the entire spectrum, to drive innovation in kidney cancer care, and to improve the outcomes for now and cure the disease and make us irrelevant in the near future. We exist to connect people. So whether that's through our education for patients, caregivers, whether it is through educational symposia for people that do clinical care in kidney cancer or researching kidney cancer, we connect experts to drive collaboration in the pursuit of ending kidney cancer for everybody. We also serve as advocates for you. So we're here for everybody in the room to assure that policies by our federal and local government enable people to get the care that they deserve and increase research funding for kidney cancer. So as Gretchen said, the resources are fairly endless. I'm proud to say that under her leadership, the KCA is more collaborative than ever before, working with other organizations that support kidney cancer patients, other organizations that support kidney cancer research. And this symposium alone is evidence that we are back post-COVID and able to support people in ways that we haven't in the recent past. So thank you again for being here. I'm going to turn it over to Joel Stern. Joel joined our board fairly recently and is a kidney cancer patient himself. And the way he got involved with the KCA was by availing himself of the resources that Gretchen and her team have made available for patients across the globe. I'll let him tell his story, but as Dr. Campbell said, he is in part responsible for us all being here today. So big thank you to Joel for his inspiration, as well as for the Joel Stern Endowment for Patient Resources that make this conference this morning a reality for all of us. Joel?
It is it's an honor to be here today with all of you patients and caregivers and the amazing doctors and Gretchen. So thank you for having me here. Other than my family, stage 4 renal cell carcinoma and dealing with cancer and giving people hope is my passion and my life. And if you have stage 4 and you don't know about our Facebook community, please find me during the break. It's an incredible community, no drama, no politics, just talking about how we can figure out how to live a long life and a quality life with this disease, no matter what we're dealing with. I feel blessed to be in year 3 plus 8 months with this disease. I've had progression a few times, but I have the utmost respect and trust for my doctors and the great hospitals I go to, my faith, my family, which is incredible. If you don't have that support team, you've got to find it, whether it's family or friends. They make a huge difference. And fortunately, after wallowing in bed for 3 months and crying in self-pity that I had this awful disease, I have found an amazing degree of optimism in living life to the fullest. And I can happily say that despite this disease and pre-progressions, I've enjoyed life more than I ever had because I don't take any day for granted. The Kidney Cancer Association is not only critical to me and my welfare, but it's critical to all of you and both patients and caregivers around the world. Thousands are taking advantage of it, but thousands are not aware of what the KCA does. And we all have an obligation to make people aware of it. The Kidney Cancer Association advocates for patients at every level, from stage 1 to stage 4, from clear cell renal cell carcinoma to some of the other subtypes that exist out there, and pushes for both advancement in research and treatment. They are at the forefront of research through their award programs and legislative advocacy, all focused with us, the patient and caregivers, at heart. As Brad and Gretchen knows, I am all in with the KCA, which is why I'm on the board. I advocate on its behalf, and it provided an endowment. And my ego, I guess, is big enough that I want to be around to see the endowment in action rather than have my family have to talk about it when I'm no longer, which is hopefully in many years from now. I encourage everyone to get involved, support our mission, and help us fight kidney cancer together. We are strong as individuals. We are a force to be reckoned with as a team. And that's really important. Any one of us is powerful, but when we get together to fight this disease, we are a force to be reckoned with. 3 simple goals for today's meeting. One simple one, I hope you all leave the symposium with more knowledge than you had before. In basketball parlance, that should be a slam dunk. So let me know if you haven't learned something. Understand and how you can get support and resources available at both the KCA and the great MD Anderson Hospital. There are many. And the most importantly, understand that the future of kidney cancer and treatment options is not slowing down. Quite to the contrary, it's speeding up, as Brad alluded to. And we're not going to give up until the KCA achieves its mission of finding a cure for this awful disease. Thank you.